We use the rapid recovery technique for our patients. I didn't develop this technique, but I did introduce it into Australia. It was developed in the USA by a plastic surgeon called John Tebbets, and when I first read about it, I didn't believe it. He calls it the out-to-dinner breast implants. Well, that's probably a bit of an exaggeration, though some people do that. We don't encourage it, incidentally. It revolves around using special operative techniques to minimise bleeding and minimise trauma to the tissues. This reduces pain, allows people to recover quicker. We've got some examples of patients who've had the rapid recovery technique and videos on our website, and please do have a look at those. Well, guess what? We used good ones on the website, but statistically your chance of being like those patients is something in the order of 65 or 70%. Obviously there is a normal distribution of patients. Some people are actually better than the ones on the website and some of them are worse. But wherever you're destined to be in your recovery from breast implants, you'll be better using the rapid recovery techniques than using more old-fashioned traditional techniques. Central to the rapid recovery technique is using an electrical scalpel to make the space for the implant. This reduces bleeding. If you can reduce bleeding, you reduce inflammation, you reduce pain, and you get a quicker recovery. About 50% of our patients say that they only need Panadol. About 50% of the patients feel able to drive a car the next day or go shopping the next day, for example. There's no special bandaging, just a little bit of tape over the wound. There's no strapping, there's no special bras. You're allowed to put your hands above your head immediately after the surgery if you wish, and you can lift weights of up to 10 kilos as soon as you feel comfortable to do so. Obviously there are certain things you can't do, lifting more than 10 kilos, contact sports, aerobics, really strong chest exercises. You're still going to need 4 to 6 weeks before you're going to get back into those kind of activities. We perform the surgery in a licensed day hospital. You'll be asleep while you have the surgery. That's a necessary part of the rapid recovery technique. One question that a lot of patients ask me is, when can I have sex? To which I usually reply, please wait till you get home. Seriously though, sex is no different to any other activity. You're not going to want to be involving your breasts in sexual activity for a few weeks after the surgery. But by about 4 to 6 weeks, your sex life should be back to normal, hopefully better than normal.